Hi, I'm Teresa Martin from Lower Cape TV, and your host for The Minds of Summer, produced in partnership with the Cape Cod Institute, which brings leading thinkers and doers from around the world to its renowned week-long workshop right here on the Outer Cape. Humans, all of us, we have this amazing ability to both inflict and physically survive this thing called trauma. I mean, everything from small daily moments to unimaginable violence and national disasters, wars. With me today is Dr. Debbie Korn. Dr. Korn is in private practice and is also a faculty member at the Trauma Center at Justice Resource Institute in Boston and the EMDR Institute. She was previously the clinical director of the Women's Trauma Programs at Charter Brookside and Charles River Hospital. But in a nutshell, what she does is helps people figure out how to recover from this thing called trauma.
Yes.
Welcome, Dr. Korn. It's great to have you here.
Thank you. Thanks.
So I just want to start out, this word trauma, we use it a lot. We have drama. I mean,
Yes.
but it's something that's very real and very specific. Can you help us understand what trauma in the proper sense really is?
Yes. I think we can talk about single event, single episode traumas that are events that have affected many people. Car accidents, war, combat, assaults, rapes, various events that most people can relate to somewhere along the way in their lifetimes. And there's also traumatic experiences that are more prolonged, more chronic, growing up in families where there's incredible hardships, where there's sexual abuse, physical abuse, emotional abuse, where there's a lot of traumatic loss, and when there's also neglect or deprivation or growing up under conditions of poverty. And all of these kinds of circumstances would come under that headline of potential trauma.
What's the difference between trauma and it was difficult or it was unpleasant?
I think we would call an event or an experience traumatic when it is overwhelming to the individual. So trauma is subjective and it's also developmentally bound. And what that means is what might be traumatic for one person is not necessarily traumatic for the next person. And it also depends a lot on where somebody is developmentally, how old they are, what their internal resources are. But I think it has a lot to do with whether someone has social support in their life, they have other people to help them through. It depends on what kind of internal resources they have. And it depends on the nature of trauma. We know that when trauma happens in an interpersonal context, it happens within families, it happens with people that you know. It's much more complex, and the effects can be much more complex.
That variation is fascinating because, we all know stories. We have wars, sadly. We always seem to have wars.
Absolutely.
And people come back from wars with different kinds of damage, some physical, some, PTSD, which for a long time people didn't even believe was even real. Because they would say, well, you were next to each other in this battlefield and, he's sad and you claim you're disabled. And how can that be?
Yes. Yeah, but we know that there's individual differences. One thing we know that predisposes somebody who goes off to war and encounters horrible events is that if they have a previous trauma history, a previous history of being exposed to trauma, if there was violence in their family growing up, if there was traumatic loss at an early age, if they grew up in poverty, that they're likely going to be more predisposed, more vulnerable to the negative impact of later life traumatic experiences.
Does trauma always have to be a big thing, a war, a bomb?
Such a good question. No, not at all. We talk in the trauma field, we talk about big T trauma and little t trauma. I talk about loud trauma, shock trauma, and quieter trauma. And when we talk about big T trauma, we're talking about the kinds of traumas that anyone would associate with traumatic experience. So we are talking about abuse, sexual, physical, emotional.
Right.
We're talking about combat. We're talking about the 9/11 experience.
Right.
We're talking about the marathon
Yes.
bombing that anyone would understand as a traumatic experience. But there's also those quieter experiences or those experiences behind closed doors that have to do with, you know, perhaps growing up with a parent who had been traumatized themselves, or growing up with a parent who's a combat veteran themselves, dealing with their own PTSD. And what is it like to grow up with a parent that is unavailable, or that is dealing with their own depression or their own anxiety or their own symptoms that really takes a toll on their capacity to parent well. So what we're understanding in more recent years is that that you can have symptoms that are very similar to the kinds of symptoms that individuals have when they've been exposed to one of those big T traumas, but you can have those kind of symptoms as the result of this exposure to deprivation or neglect or chaos growing up in an alcoholic family as well.
Well, it's interesting because we always think of trauma as something that happens to us, but what I'm hearing you say is trauma can also be something that didn't happen, kind of the absence of something.
Yeah, we absolutely talk about acts of commission and acts of omission.
Commission and omission.
Let me define.
Yeah, please.
Absolutely. So when we talk about acts of commission, again, we're talking about the obvious traumas, things that are committed against another, right? So the abuses, sexual, physical, emotional.
Committed against
Committed against. Omission is the absence of something, right? So it's the child that grows up in a family where, you know, there's no one to meet their emotional needs. You know, maybe they're one of many, many kids in a family where both parents are out. If they're lucky enough to have two parents, they're out working round the clock, sleeping when they're not working. And, you know, these latchkey kids that have to raise themselves. Or, you know, dealing with parents that just don't have the emotional capacity to stay regulated with them, to stay kind of attuned to them. And so when they experience things that are hard growing up, there's no place to turn. They're very alone. And they wind up adapting to that in their own way. Maybe they turn to substances, alcohol or drugs at an early age. Maybe they start to run around with a gang because they want they need a family and they need somewhere to belong. Maybe they, you know, maybe they injure themselves. You know, I think people are familiar with the fact that some kids may cut themselves or self-injure as a way to get relief or to express to the world what's going on. But they're all adaptations. They're adaptations to the fact that certain needs are not getting met along the way.
Over that, have most people experienced one kind of trauma or the other?
You know, I think that, I don't know the statistics off the top of my head, but I think that when you start talking to people, you discover that, that trauma is a part of life. That, you know, most people have been exposed to a car accident, have, you know, had some kind of traumatic loss, whether it was a loss of a pet that, you know, was their best friend.
Well, you're saying it's all contextual, so to each person,
it's all contextual.
Some person may say, bye-bye Fluffy, get another Fluffy, and not give a second thought.
Exactly.
And for someone else, it's
huge.
Huge.
But for someone else who grew up without parenting that met their needs, without being accompanied in the tasks of growing up, that Fluffy, that cat.
Yeah, I'm not being flippant about cats, by the way.
No, of course. No, but that cat may have been everything. That cat may have been, or may be a primary attachment, a primary connection. And the loss of that primary connection might be devastating for this one person.
Well, how do we know, by we I mean, you know, we who interact with people around us, if someone is reflecting the result of a trauma, or they're just having a bad day, or they're unnecessarily grouchy about something? How do you know
sort
what
it
that
out,
is?
parse it out, Well, post-traumatic stress disorder
Right.
is a well-established diagnosis, and there's a set of criteria. There's a set of symptoms that have been studied and that are commonly associated with the effects of trauma. And so, for example, when we think about simple PTSD, which is not so simple, but we refer to it as simple versus more complex, more prolonged, more chronic trauma. We see symptoms of, we call them intrusive symptoms. So the intrusive symptoms of PTSD are the symptoms that intrude in on everyday existence. So nightmares when one is sleeping, flashes, flashbacks, or intrusive images of something that happened. Thinking endlessly about what happened, what one should have done, what happened but didn't happen. Really traumatic recall of the experience that the individual doesn't have control over. Those flashbacks just come.
The bomb goes off again.
Exactly.
Or
the car backfires on the street and the combat veteran heads for cover under the couch.
Yeah.
That's what we would call the intrusive symptoms of PTSD. And sometimes they're very loud, right? They're dramatic and they're debilitating. And sometimes they're quieter. They come up and the individual may be able to continue their work throughout the day, yet they are having to use every ounce of energy to manage that and to stay oriented to present time and place. So those are just the intrusive symptoms. Then there's the symptoms that have more to do with avoidance and kind of constricting, kind of bracing oneself against these memories that are getting activated in the nervous system. So that's the process of kind of shutting down, numbing out, avoiding anything that might be going on in the environment. And then there's also what we call the hyperarousal or symptoms of hypervigilance, which are the startle response, right?
We've heard about that a lot with post-Iran, Iraq.
Absolutely. Yeah. We know this very well from our combat veterans, from anyone who was a part of 9/11 or a part of marathon bombings, just to call upon more recent experiences. But that hyperarousal is that jumpy nervous system. It looks like high anxiety. It's a vulnerability to getting triggered, stimulated, and kind of thrown into the past. And with that vulnerability, the past becomes present. Suddenly, the individual is not sitting in their living room anymore, but they're back in Iraq. They're back in New York City on September 11th, 2002. Is that right? 2001. 2001. Right.
So how long does trauma last? I mean, because you hear people say, "Oh, it happened, just get over it." You hear people say those things. And is trauma there forever? Is trauma,
Yeah. So maybe let me back up a little bit and do a kind of a little trauma 101.
Okay, trauma 101.
Okay.
Here we go.
So when an individual goes through everyday life experiences, non-traumatic experiences, so let's say you go to a party and you see your friends and you eat good food and you make conversation, and that night you go home and maybe you talk with your partner about who you saw and what you talked about. And that night you go to bed and maybe you have a dream about the party, but by the next day you have processed through that experience. It kind of goes up on the shelf as a past experience. You don't feel haunted by it, hopefully. You don't have flashbacks about it. You've processed through this life experience, and it either gets discarded or what the important part of the experience.
Some good thing. I remember that grape hair earrings that person had.
Exactly.
I'm gonna keep an eye out for it.
Exactly. So maybe that piece gets logged as a memory to hold on to because it's important information for some reason. The brain is able to sift through and decide what to keep and what to let go of. But when something is traumatic, meaning it is overwhelming, beyond being able to be processed for a given individual, something very different seems to happen. It appears that traumatic experience gets frozen or locked in the nervous system with all of its component parts. So it gets locked or frozen in the nervous system with the feelings that were part of the experience, so the terror, the panic, the despair, the hopelessness. It gets locked in the nervous system with the thoughts that were part of the experience. Right. I'm going to die, I'm powerless, I have no control, I'm in danger, it's my fault, right. I should have, I could have. And it gets locked in the nervous system as well with the sensations that were part of the original experience. So maybe physical pain that was part of the experience, or knots in the stomach, or butterflies, or whatever the sensations were that were part of the experience.
Just kind of in this loop.
Exactly. It also gets locked with images of the events. So we think about flashbacks or nightmares. Yes. The images, the worst parts of the experience get locked in the nervous system. And also sensory experiences, so sounds and smells and
so
taste.
People jump,
Exactly, that can get locked in the nervous system. And all of that kind of remains in the nervous system until something else comes along that activates that constellation of experience. And that may be days later, that may be months later, that may be years later. That may be many years later. So I see many people in my practice who were abused in childhood. I see combat veterans who served in Vietnam. So a lot of time has passed, but if they have not gotten appropriate treatment, that traumatic, those traumatic experiences are still locked in the nervous system, waiting to get triggered, by a car backfiring, or by a rejection from a boyfriend or a girlfriend, or harsh words from a boss could trigger the abusive father who was humiliating and horrible with words.
So, are you doomed to have these things sort of stuck here spinning forever, or what do you do? Or worse yet, what if you see this in a loved one, in a spouse or a parent?
Yes.
What's your trigger to help move it forward?
Yeah. So I get very sad when I hear people use the word doomed or talk about kind of the chronic nature of trauma, and I hear people say, you just have to learn to live with it.
Yes.
And I think that's absolutely not true. In 2015, we actually have many, many different models of psychotherapy that are really quite helpful with trauma. And I think it's a matter of really recognizing that you're suffering from the effects of trauma. What has gotten labeled as depression or anxiety, or somebody who has an eating disorder, or someone that that has panic attacks. You may get multiple different labels, but in fact the unifying concept, of the unifying experience across people that have these multiple kinds of symptoms may be exposure to trauma, and that it's a matter of getting to the trauma that's still frozen or locked in the nervous system to try to complete the processing of that experience so it can get put up on the shelf, just like that normal everyday experience. And there are absolutely many, many paths to that kind of healing. And it's a matter of, as I said, recognizing that you're dealing with trauma, and then looking for an appropriate treatment program or an appropriate therapist who is trauma informed, who's trauma trained, who really knows how to proceed in terms of helping people get relief from the symptoms of trauma.
You said something that I actually had a question about, which is, we see people diagnosed with all kinds of things.
Absolutely.
You're depressed, you're anxious, how does somebody know, or how do you know about someone else when it's trauma, or when it's not simply, but it's, ongoing depression?
Yeah. Well, I think, there's a lot that you can read these days that I think gives the overview of the symptoms of trauma. And I think anyone that is, dealing with a range of symptoms that are trauma-related, that are trauma-based, would recognize themselves.
So you've got this package of things. So it's not a one thing.
That's right.
It's a package.
That's right. And so the depression may just be one part of it. The depression might either reflect the despair and the grief and the sadness connected to the traumatic experience that never got processed and resolved, or the depression may be part of the adaptation to the trauma, meaning
Meaning,
someone experiences a trauma or they experience chronic trauma.
right.
They don't have the ability to go and talk about it and work it through. They have to learn to adapt to it. They have to figure out where to put that trauma. So the trauma gets pushed away, it gets disowned. You know, that didn't happen to me, that didn't matter, I don't feel anything. It gets compartmentalized, it gets dissociated and put over there. But it's still in the body.
Right.
And it's going to come out symptomatically along the way. So depression can be related to the fact that there's all of this intensity in the body. There's terror and there's grief and there's anger and there's the impulse to fight back, and maybe the person didn't get to fight back because the perpetrator was bigger and stronger.
Right.
You know, maybe they didn't get to flee. All the normal healthy adaptive reactions when bad things are happening because they were captive in some way. And so they somehow had to learn to push those feelings, those impulses away in order to keep functioning in life. And so those experiences get suppressed, and in order to suppress it, they have to shut everything down. Now, what does depression look like? Depression looks like shutdown, right? I can't move, I can't speak, my thoughts are unclear. So, in fact, depression may be just one symptom of the constriction, the avoidance symptom of post-traumatic stress disorder. And so I think, you know, if one knows that they have been through difficult life experiences, what they would define as difficult.
That's the key
as
part.
they would define. And even if they wouldn't define their life as having been touched by trauma, if they're having a range of symptoms, go and talk with someone. Go and talk with someone who knows something about trauma. And then it's up to the professional to really evaluate and to kind of connect those dots and help an individual see that there's probably a good chance that this symptom and this symptom and this symptom that's each being treated individually, this one with this medication and that one with that medication.
It's a lot like the way we treat physical ailments,
as
where
opposed to
you're sneezing, you take this, your wrist aches, take this.
Exactly.
But it's all somehow related to, you know, an allergy to dog
and
fur or something.
there's a trend, toward more holistic medicine that really tries to step back and look at the big picture and see if we can treat the system, see if we can treat the big picture. And so I think it's important to recognize when these multiple symptoms might be related to exposure to trauma, and that it might mean that healing will only come when the individual can begin to turn their attention back to the trauma, which is not what people are excited to do.
No, I don't want to relive that moment when the bomb went off, or the car hit us, or
exactly. But you know, if you're working with somebody that is educated in trauma treatment, that really has expertise in doing this kind of work, they're going to accompany you. They're going to be at your side. They're not going to let you drown. They're not going to let you get overwhelmed as you begin to touch into the feelings or the sensations or the thoughts or the impulses or the images connected with those difficult life experiences. They're going to be right there helping you to kind of stay within that kind of window of tolerance, kind of that optimal arousal zone, as we call it.
We can be processing the stuff in a healthy way, not setting it aside and not stalled out.
Exactly. Yeah. So not overwhelmed by it, not flooded by it when you go near it, not shutting it out, but kind of working within a zone that feels manageable and that's going to allow you to complete that processing in some way, you know, and completing it may be just really being able to play the movie through and put words on it and stay with the feelings that come up around it. Processing it may mean being able to say things out loud or in your imagination to the person that hurt you that you were never able to say back then. It may mean being able to imagine doing what you couldn't do back then, you know, fighting back, triumphing, triumphing.
I like triumphing. It's better than doomed.
Yeah.
Doomed, triumph.
Yeah. But,
Yeah.
you know, trauma is all about truncated action. Let me define that.
I like that.
Yeah. Trauma is all about actions that never happened because, again, the perpetrator was too strong, too big. The enemy was right there because you couldn't run, because you couldn't fight, because it was too risky to speak and to, you know, you might lose a relationship. If the person that's hurting you is a parent and the person you depend on and the person that you're attached to, even though the treatment is harsh, to actually fight back might threaten the only place where you belong. And so those words don't get spoken, those feelings don't get expressed.
Or your child who knows nothing different.
Exactly.
I mean, how do you fight back if you don't know there's any other alternative?
Right. You don't know that the treatment you're getting is any different than any other kid. You don't know that you have a right to be angry about this or to say this is not okay.
Wow. So has trauma always been with us? As a species, have we always had trauma?
I would say that there has always been trauma. I think the nature of the trauma is different, perhaps, than in the past because we're living in a world that now, you know, combat and warfare, the nature of warfare is different than it used to be. But there's always been war.
Yeah,
There's always been war. And it didn't used to be called PTSD, but, you know, it had many other names going back in time. But, you know, so there's always been war, there's always been violence, there's always been traumatic loss. You know, in the old days, traumatic loss from illness, from disease, was much more part of people's childhoods. They often would lose parents in childhood, whereas I think that's less common today. But I think trauma has been around undoubtedly since the dawn of time.
Do you think that because we want everything to be perfect now, we have made it harder to process traumatic events?
Ask me that question in another way. I'm not sure.
Well, I'm just thinking, you said, you know, the traumatic things have always happened.
Yes.
You know, 100 years ago, children would die, people would lose families.
Yes.
Now, that would be a very traumatic event.
Yes.
Was it because it was more common and people could talk about it to enable processing to happen, and now we don't anymore?
Yes, yes, yes. So I think, you know, a very interesting story that comes to mind as you're telling me this. I was teaching a trauma treatment method called EMDR in Bangladesh many, many years ago. And our host, who was a psychiatrist in Bangladesh, took us on a walk, those of us that were doing the training, took us to a park and showed us around. And there were kids playing in the park who had shredded clothing, bare feet.
Right.
They were dirty. They clearly came from severe poverty. And he called one of the kids over and interviewed the child and said, "So tell me, how's your life?" And the kid said, "Life is great. Have any bad things happened to you?" And the kid said, "No, not really. No, you know, everything's okay." And we're looking at this child looking kind of forlorn. And he did this interview with this child, and then the child went on his way, and the psychiatrist leans into us and said, he lost his father and his brother and his uncle in war. His house was destroyed by a monsoon. And yet, he was living in a culture where this was not unfamiliar, right? Where there were natural disasters, where war was a part of life. And so it doesn't register about it. And the people that surround this child talk about it, as you're saying. It was a universal, these experiences were universal. And so there was room for conversation, room for grieving, room for all of this within the culture.
Amazingly, we've barely begun to tap the surface of trauma and what it is, and yet we are out of time. This has been really wonderful. I've learned so much.
Great.
I'm Teresa Martin with Lower Cape TV, and with me today has been Dr. Korn, and we've been looking at trauma and the nature of trauma, and what it all means. So thank you very much.
Yes, you're very, very welcome.